Teeth are vital structures within the body of the human being, and they serve very vital function for the survival of a human being. My name is Dr. Chege Mbiu. I'm a dentist with Arrow Dental. Arrow Dental is a facility in Nairobi CBD, Yala Towers. And today, ladies and gentlemen, we'll talk about teeth and one of the most common problems or common discomfort that affects people. So let's just begin. So teeth are structures that are housed within the oral cavity, and they are not the only structures within the oral cavity. The oral cavity is the mouth, and we use our mouths to do three things. One is to eat, what we call chewing. In dental terms, that is called mastication. Number two is speaking, what I'm doing right now. You can say Sasa or Mombasa without teeth. And function number three is the aesthetics. You want to look beautiful, you want to look nice, you want to smile. And now these three functions have to be maintained in the right state. And if they go down or they reduce, we improve or restore. Let us talk about the biggest dental disease that we have, and those are what most people call holes on teeth or cavities. So how do we get cavities? For me to be able to explain how we get cavities, allow me to use this structure here. This is a cross-section of a tooth to explain the structure of this beautiful organ. One, a tooth is made of mineralized tissue and has three layers. The outer layer, we call it enamel. Then the middle layer, we call it the dentin. Then we have the inner layer where we have the blood vessels and the nerves. We call it pulp. So when we talk about holes or cavities, how do they come about? The mouth, we must understand, that has very many bacteria. They're in thousands. You can't finish them. It doesn't matter how hard you brush, you can't finish all the bacteria in the mouth. So these bacteria, when they have increased contact with sugars in the oral cavity, they break it down to produce an acid, which we call lactic acid. Lactic acid eats away the enamel or the mineralized tissue that we talked about, and we start now having cavities or holes on teeth. The cavity begins on the outer layer called enamel, and it is not alive. The outer layer does not have nerves, so you may not have symptoms, you may not have any discomfort. But as the disease process, which is now the destruction of the tooth structure, goes on to the middle layer, which we call the dentin, that layer has nerves and blood vessels. The nerve endings are very sensitive, so you start experiencing sensitivity. You take something cold, something hot, and you start feeling discomfort. If that cavity progresses to where we said the inner layer, where we have the nerves and blood vessels, then you get obvious pain at night, pain that is very severe. You get headaches that are usually one-sided. That pain can be so severe that it moves from one jaw to the other. In our terms, we call it pain radiation. Not once or twice, a patient will present to the dental clinic complaining of pain, but they are not able to localize where that pain is coming from. That is because the nerves that come to the face, they branch out into different branches, up and lower, and the pain can move from one branch to the other. So when you have a cavity, we have said that you can have symptoms or no symptoms, depending on the extent or the size of that cavity. You can see it or you may not be able to see it. There are those obvious cavities that you can see with your eyes, and even a dentist can identify as this is a cavity and we need to fill it. But at times they are cavities but you can't see them. So there comes a time we need to take x-rays, because teeth are in very tight contact. You look at my model here and you see that teeth are in very tight contact. You can't see a cavity that is on the middle part. We call it proximal, and you need to take an x-ray. Once you take an x-ray, it shows you the position and the size of that cavity. So once you have identified that yes, this is a cavity, there has been destruction by the acids produced by bacteria as they break down sugar, what is your line of management? Management number one is patient responsibility. We must ensure that now moving forward, the patient must brush thoroughly. We insist on brushing 2 times every day so that you can protect not just the tooth that has a cavity, but especially the others that may not have had cavities forming. Number 2, when you have a cavity, as a dental practitioners, we have a responsibility to restore the tooth to natural form. So how do we restore a tooth that has a cavity to its natural form? Number 1 objective is to remove the disease process. Decay itself is a disease. There are bacteria involved. There is destruction of the tooth structure, and that area is soft. So what do we need to do? We need to clean up that tooth, clean up the area that has a cavity, ensure it is very well debrided, very well irrigated with water and with solutions, and it is very clean. Then you put a filling. What is a filling? In layman terms, I would say ni kama kiraka ya meno. The tooth has a cavity, you need to patch it up. We majorly have 2 types of fillings. They have the white fillings and a silver filling. White fillings, we call them composite or GIC. Then the silver fillings, we call them amalgams. So when it comes to putting those fillings, where there is a discussion between the dentist and the patient on the most preferable filling, you can do white, you can do silver, both of them serve well. The process is when a patient comes, and the patient is on the chair, you've done your x-rays, you've done your examination, you cannot work in the mouth when the patient is not numb. I know most people, including myself, if you are to change the roles and become a patient, we don't like injections. But unfortunately, we have to numb you with an injection to ensure that the area around that tooth does not perceive pain. So you get numbing, you get an injection to ensure that that area is numb. Then using the many instruments that we have, we start drilling the tooth. If you visit a dental clinic, you'll notice a lot of noises coming from the machines, which are majorly driven by air and electricity. And you drill the tooth, you protect the nerves and put your filling. So once you put your filling and you have checked that the filling is adequate and the filling is okay, you discharge the person or the patient, and with instruction, most importantly, to brush their teeth and to report any case of severe discomfort that may come after treatment. Now, there are instances when the cavity is very deep that you cannot just do a filling. You cannot just patch up that tooth, because even if you patch up that tooth, you will continue having pain. So this is when, from a clinical assessment, the damage has reached the nerves. And it's obvious, both clinically and radiographically, that the nerves are damaged or they're infected or inflamed. Management, what do we need to do? We need to get those nerves out. And when it comes to root canal treatment, apart from removing the decayed parts, which we call caries or dental decay, you proceed on to where the nerves and the blood vessels are. And once you are there, you do your root canal, you usually say in 2 or 3 stages. The first stage is to ensure that the nerves are well removed and they are very clean. The canals are very clean. Looking at my tooth, which is here, a tooth has the upper layer, which is clinically visible in the mouth, and we call it the crown. Then we have a lower layer that is hidden within the bone and the gums. We call it the root, and that is where the name root canal treatment comes from. So we open up the tooth and go very deep to where the roots are, and within the root we have canals, we have chambers that house the nerve and the blood vessels. So you go to where they are, remove them, clean them. Then in the subsequent visits, we ensure that those canals are well filled up, and you restore the upper part of the tooth, and the patient is able to eat with that tooth. Some key questions that people may want to ask is, should we fill milk teeth? Yes, we should. In as much as possible, we recommend children who have cavities, we retain their teeth for as long as possible before the permanent teeth come, so that we preserve space. We preserve that space. So yes, children, fillings are done, not just at Aro Dental. I'm sure even other facilities, both government and private, are able to put fillings on children's teeth. Would you have fillings when you are pregnant? Yes. We usually say as long as the pregnancy is stable, no complications, no diabetes, no hypertension, you can have dental treatment when you are pregnant. We can fill those teeth. How long do fillings last? In medicine, we say do no harm. We try as much as possible to do the right thing, to fill the tooth in the right way, using the right materials. And a filling can last you 10 to 15 years. But there are those instances that a filling can fail, including after a few days you are eating and the fillings come off. No need to get worried. Dental practitioners can always restore that filling if it gets lost. There is that conversation around silver fillings, that they have a bit of mercury. True, the silver filling, which we call amalgam, has a bit of mercury that is used to make it better compacted, and so that it can sit well on that tooth. The mercury is little, but if you had to have all fillings on the people in Nairobi find their way to Nairobi River, they would form a critical mass, and that would be an issue to the environment. They serve well. There is no need to get worried if a dentist recommends that you do a silver filling. They have been there for more than 100 years, and they have served well, and we are happy about it. Talking about the white fillings, we majorly do them for the front teeth because they're aesthetic, they are appealing. We try as much as possible to match them to the teeth. We have different shades of teeth. Shades meaning there are people who have very bright teeth. We can call it an A1 or a number 1. Then those who have medium, number 2. Then there are those, their teeth are a bit dark, that you can call it number 3. And we match to the shade of your teeth. And all those are normal. However, I'm sure people are wondering what happens to the people who have very brown teeth because of fluorosis, those people who come from Naivasha, or those who take borehole water, including in Nairobi and other areas. Yes, fluorosis can damage the tooth to the level of giving us very, very severe discoloration. But even then, we still fill those teeth, then manage the discoloration as a completely separate treatment, which I believe we'll talk some other time on, by whitening. We try as much as possible. From our end to ensure that the comfort of chewing comes back in less than 24 hours, so that by the second day you are able to chew. Again, one of the things why we limit a day or so is, especially when you're working with a silver filling, is because it takes time to harden. It takes time to harden up to 24 hours. Ladies and gentlemen, thank you very much, and we hope to meet you on the other side as we offer treatment to
is the perfect place to get away from the hustles and bustles of the city. Rest and recharge in our cozy bedrooms as you plan to move around Mombasa. At Pawenzi, we have fully serviced studio apartments, 1-bedroomed and 3-bedroomed apartments. Enjoy the breathtaking and scenic views from the balcony before you head down to Shanzi Beach. Located right off the Malindi Mombasa Highway, Pawenzi is easily accessible and ready to receive you with the joy that is synonymous to Mombasa. Call us today and book your staycation spot.
I want to talk about a certain attribute of the teeth. There are 3 things that revolve around attributes of the teeth that I'll mention. Number 1, teeth have a particular shape. Every tooth has a unique shape. Right from the front teeth, which we call incisors, the middle teeth, the canine and the premolar, and the back teeth, which use for chewing, the molars, all have a particular shape and size that is fitted to their function. The front teeth for biting, the canine for tearing, the back teeth for grinding. Attribute number 2, I've said shape, size is the second one, and attribute number 3 is color or the shade. The teeth have a shade which moves from white, off-white, all the way to yellow. When the teeth come into the mouth for young ones, the milk teeth, they are milky white. Part of the reason why they are called milk teeth. For adults, the shade or the color is from white all the way to yellow. Again, as we age, teeth become yellow. By the time you're 70, your teeth are generally almost yellow because of structural changes. So now we have mentioned that the teeth have a particular shade that is God-given. Now, let me talk about discoloration. So when we say that there is discoloration, discoloration is broadly divided into 2. We have external discoloration or extrinsic, and internal discoloration or intrinsic. So external discoloration, just from the name, you get the discoloration from external things, from smoking, from tea, black, from coffee, again black coffee, some certain vegetables, greens, those people with humera and such things. I mentioned smoking, but the greatest cause of stains that are external is lack of adequate brushing, and there is accumulation of tartar, there is accumulation of plaque that appears yellow. You open your mouth and on the lower inside part you see dark things going all around. That is tartar that accumulates over time. Where do we get tartar? Let me mention there are bacteria in the mouth that break down sugars. So those sugars and the minerals accumulate and form hard things around and along the surfaces of the teeth, giving you tartar that is discolored. So when you have a stain that is external, the management is very different from a stain that is internal. So what are these causes of a stain that is internal? A stain that is inside the tooth, most common causes are 1, medication. When that tooth was forming, a tooth starts to form very early. For children, a tooth starts to form 8 weeks inside the mother's womb. The permanent teeth, right from 1, 2, 3, 4 years, the teeth start forming within the jawbone. If you were to take an x-ray, you would see teeth have already started forming. So if a child at that time has a prolonged exposure to medication due to a prolonged illness and admission, then we can have interfered formation of the tooth structure, and when the tooth comes out, it's grayish or any other color. The next most common cause of a stain or discoloration that is internal is fluoride. Fluoride. We have fluoride in the waters. Fluoride beyond a certain limit, which is, we say 1 part per million, when you take it to the lab, interferes with the formation of the hard tooth structure of a tooth, and it becomes weakened, gaining the discoloration that you see for people who consume water from boreholes or from rivers that have excess fluoride. Fluoride, the stain from fluoride can be again classified right from mild, that is a bit yellow with the stains here and there, some white patches, moderate or severe, where you have gross destruction of the tooth structure. The tooth is very brown, the enamel is even eaten away. We call it mottled. It's like there were some ants that were eating the enamel. That is in extreme forms of fluorosis. So each of these discoloration, internal, external, are managed differently. Let us talk about external discoloration, that is on the surface of the tooth. After identification, the next thing to do is cleaning. The routine cleaning that is done by dentists in a dental clinic, using water, using a brush, and using a machine that vibrates around the teeth to remove all the dirt or the debris or the stains. We call it a scaler. And from the name, the treatment, we call it scaling. Cleaning is a general term, but from a dental point, we call it scaling. You remove all the dirt with a machine that moves around the teeth. Once you are done with that, you polish with a brush and a paste so that the external stains come out. Now, once we are done with that, the next question is to remind the patient or request the patient to modify the behavior that could have given us those external stains. If it was inadequate or improper brushing, then we get a brush and we demonstrate to the patient the right brushing technique. And we say, with your toothbrush, this is your mouth, you brush back and forth for back teeth at a 45 degrees angle to the gum line. It's called a modified burst technique. Up and down, right? You can do circular for the front teeth and never up and down, never up and down. Because if you do up and down, you'd cause recession. What is recession? It's the gum going away and your tooth appears longer than it ought to be. When you're brushing, there could be a few side effects to some of the options taken for whitening, like bleaching, but they are short-lived. If you look at the benefit of doing such treatment, they far outweigh the little discomfort for a few days. So visit a dentist for a review. Come to Arrow Dental in Nairobi, go to Thika or any other hospital, and you'll be able to be served. So it was my joy to talk about teeth whitening. I'm Dr. Chegembiu, a dentist working with Arrow Dental.